Hello everyone, happy October Awareness Month. October is a month where we talk about the awareness of a bunch of different exceptionalities such as ADHD, autism, Down syndrome, learning disabilities, dyslexia, and mental health awareness. Throughout this month I'm going live at 10:30 to discuss some different concepts with you, and then again at 5 with another expert or advocate in the field to help you understand and get a better idea of the different things that we're trying to bring awareness to this month. And today I am focusing on discussing the DSM-V, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This is what professionals use when it comes to diagnosing and checking criteria for diagnosing of various exceptionalities. Elsie! Sorry. And it's for talking about personality traits, cognitive functions, physical signs, and behavioral disorders. And so this is the book that physicians and psychologists reference when it comes to trying to figure out if an individual meets the diagnostic criteria for a certain diagnosis. And it's something that as a parent you don't need to worry about. As a teacher you might want to be familiar with some of the more common diagnoses because it does go into detail, and its purpose is to be used by trained clinicians, but that's why I said it's important for professionals such as teachers and school counselors, special educational consultants to be aware of, because then it helps you understand the different traits that you're going to be finding. So there are 4 guiding principles behind this DSM-V, and they are that it must be feasible for professionals to use on a routinely basis in their classroom, in their clinical practice. So when you look through this book, it's in alphabetical order, and it has a diagnostic criteria, so they can flip to a diagnosis, find out what it means, and look at the diagnostic criteria and the diagnostic features. So this means that there's more of a consistent way to make sure that if one professional diagnoses an individual with some sort of exceptionality or disorder, then it means that it'll be more consistent around other individuals, so that if your pediatrician diagnoses you with your child with one condition, then it's very likely that their general practitioner would also feel the same way. Now, this manual gets updated every so often to reflect the new research and findings that we learn about the different disorders. And it's important that it's backwards compatible. And what I mean by that is that if you're diagnosed with something based on the DSM-V, when they release the next one, you'd still be considered to meet the criteria for that diagnosis. And so when they do that, the new editions, they conduct experts in the field that know things about the diagnostic criteria and the research that is currently available in the practice, so that they can make sure that it's current and it meets what the general consensus of professionals in that field feel are the diagnostic criteria. And it also means, when these changes are made to the DSM, just because there's a new edition doesn't mean that every condition needs to be updated. If there is no new information and no new diagnostic criteria or changes in opinions about the diagnosis and the conditions, then it doesn't have to be updated. It can stay with what's been seen before. So this is something that we have been having around for a while now. The first edition was published in 1952, and it's published by the American Psychiatric Association. So it's something that any psychiatrist or person that working with mental disorders and conditions, so an educational psychologist, a pediatrician, or even some GPs should have something like this so that they can reference it to make sure what they're seeing in their patients doesn't fit a diagnostic criteria. So in this manual, there are resources for specific learning disorders and for attention deficit disorder, autism. There's things about depression, eating disorders. So this is a manual that professionals are going to check to make sure that the individual has the diagnostic criteria and that it's consistent whether you are in Canada or in the United States or in Europe. It's going to make sure that it's consistent coast to coast, so that we're not saying that one person meets a diagnostic criteria, say in Vancouver, British Columbia, but if they were to travel to California, they would not. This is to make sure that there's that continuity of definitions and continuity of care. So please feel free to contact me if you have any other questions about the DSM-5. I'd be happy to discuss them or go into them further with you. Make sure you take a moment to like the Garforth Education Facebook page so you can find out about more of these talks that I'm doing all throughout October. And if you're an educator, please join the Garforth Education Educators Group. If you're a parent, join the Garforth Education Parent Group. And if your child meets one of these diagnostic criteria, please join the Garforth Education Exceptional Parents Group. Thank you for joining me, and I'm glad you're finding this to be a beneficial talk. Have a great day.